Surgery for 8th semester students of the Faculty of Medicine. Surgery. Definition of surgery. Surgery is a branch of medicine that studies the diagnosis, management, and treatment of diseases or medical conditions through procedural or operative approaches. The main goal of surgery is to treat diseases that cannot be addressed with conservative medical treatments and to improve the physical condition of patients affected by injuries or diseases. Learning objectives of surgery. In Semester 8, the learning objectives of surgery are to prepare students to understand the basic principles of surgery and the techniques used in surgical procedures. Be aware of the indications and contraindications for surgery. Manage surgical patients, including preoperative, intraoperative, and postoperative care. Handle complications that may arise after surgery. Understand the basic principles of anesthesiology that support surgical procedures. Main topics in surgery. 3.1 Introduction to Surgery. History of surgery. Tracing the development of surgery from ancient times to the modern era. Focusing on the advancement of surgical techniques and tools, as well as the improvement of patient safety during surgeries. Basic surgical principles. Asepsis. Procedures to prevent infection by maintaining cleanliness in the surgical area. Sterilization. The process of eliminating pathogenic microorganisms using various methods, autoclave, disinfectants. Anesthesiology. Understanding the types of anesthesia, local, regional, and general, and the basic principles of administering anesthesia. 3.2 Basic surgical techniques. Incision. The procedure of cutting through skin or other tissues to reach the required area. The cutting technique must be done carefully to avoid damaging unwanted tissues. Dissection. Separating or cutting tissues around an organ or anatomical structure to access the desired area. Suturing. The technique of stitching a wound after a surgical procedure to restore the integrity of the skin and underlying tissues. Various types of stitches are used according to the type of wound and body area. Hemostasis. Stopping bleeding, either through mechanical, thermal, or chemical techniques. To control bleeding during or after surgery. Drainage. A procedure to remove fluids or pus from a wound or body cavity after surgery to prevent infection and other complications. 3.3 Surgical patient management. Preoperative assessment, physical examination and diagnostic tests, laboratory, radiology, to assess the patient's general status. Identifying risk factors such as hypertension, diabetes, heart disease, and allergies to medications or anesthesia. Consultation with specialists, e.g., anesthesiologist, cardiologist, or internist if necessary. Anesthesia management, general anesthesia, used for major procedures that require the patient to be completely asleep. Local and regional anesthesia, used for smaller procedures where the patient remains awake, but specific areas of the body are numbed. Surgical protocols, preparation of the operating room and medical team. Selection of appropriate surgical tools and aseptic procedures. Developing a surgical plan and communication with the patient and family about the procedure to be performed. 3.4 Common surgical procedures. Here are common types of surgery often performed and studied in Semester 8. Abdominal surgery, appendectomy, removal of the appendix. Typically performed on patients with acute appendicitis. Cholecystectomy, removal of the gallbladder, often done for patients with gallstones causing pain or infection. Herniorrhaphy, surgery to repair a hernia, a condition where organs or tissues protrude through the body wall. Thoracic surgery, lobectomy, removal of a part of the lung infected or affected by cancer. Cardiac surgery, such as coronary artery bypass grafting, CABG, for patients with coronary artery disease. Orthopedic surgery, fractures and broken bones. Handling fractures using external or internal fixation methods, e.g., placement of plates and screws. Joint replacement, hip, knee replacement, surgery to replace damaged joints. Typically in cases of osteoarthritis. Oncological surgery, breast cancer, surgery to remove breast tumors or mastectomy in breast cancer cases. Colorectal cancer, surgery to remove tumors from the colon in colorectal cancer. 3.5 Surgical complications, wound infection. One of the most common complications after surgery, requiring antibiotic treatment. Bleeding. Excessive bleeding that can occur during or after surgery and needs immediate management. Thrombosis and embolism. Blood clots that can travel to the lungs, PE, or heart, stroke. Often prevented with anticoagulant medication. Wound healing failure. Occurs when a wound does not heal properly, often due to infection, excessive tension on stitches, or poor circulation. Shock. A critical condition requiring fluid stabilization and intensive care. 3.6 Postoperative care. Postoperative monitoring. Monitoring vital signs, patient consciousness status. And complications such as bleeding or infection. Pain management. Managing postoperative pain with analgesic medications and non-pharmacological techniques such as physical therapy or nerve blocks. Prevention of complications. Early mobilization to prevent deep vein thrombosis, DVT. Prophylactic antibiotics to prevent infection. Monitoring of wounds and drainage to ensure proper healing. Practical training and clinical practice. Basic surgical skills. Students will be trained in mastering basic surgical techniques such as suturing, cutting, dissection, and the use of surgical instruments. Surgical simulation. Training through surgical procedure simulations using models or computer simulations to enhance technical skills without risking patients. Clinical rotations. Students will rotate through various surgical departments, general surgery, orthopedics, oncology, etc., to gain direct experience in handling patients requiring surgery. Learning evaluation. Theory exams, assessing students' knowledge of the basic theory of surgery, types of surgeries, complications, and the principles of surgical patient management. Practical skills assessment. Students will be evaluated based on their skills in basic surgical techniques and their ability to manage surgical patients. Case discussions. Discussion of real surgical cases faced by patients, including diagnosis analysis, surgical indications, surgical techniques, and post-operative management.